Gastric bypass surgery or bariatric surgery brings many things to the table hormonally in a person's body. For instance, you can take a normal person who, let's say, is 200 pounds overweight. Of course, they don't feel like they're normal in any respect. And you can ask that person to not eat for a week, okay? They may not hardly eat anything for a week. And will they lose any weight? No. They generally don't. But if you do a gastric bypass on them, and the caloric intake between the two groups is about the same, because you don't eat much after a gastric bypass initially, but the gastric bypass group loses 15 to 20 pounds in the first week. When I see the people at the 6-month visit, and let's say they've lost 80 pounds, and we'll be sitting there, and I would say something like, if I put an 80-pound barbell there, could you pick it up and carry it to the door? And they, most of them couldn't, but yet they've been carrying that around, for all this period of time. So I would like to think that there was something else out there, and I would applaud industry if they could come up with a pill or a way, but I doubt that will ever occur. When we achieve such a high level of service, it's because of all the people who've gone before us. And we hope as we go forward that we even have greater surprises in store. Certainly online or with a visit to your primary care physician, you can determine if you're a candidate for the surgery. And then if you think you're a candidate, I would encourage you to attend a seminar. All the centers of excellence, many institutions have seminars. And then find a passionate surgeon, a surgeon with a good reputation, with good outcomes. But I would encourage them to connect with someone who's good at it, see if they share their passion, and see what the possibilities are.